Here, flu cases have jumped sharply in England. New figures show the number of patients in hospital has risen 55% in a week, the highest ever for this time of year. While flu cases also rising in Scotland, but at a slower rate. NHS bosses say they're facing a, quote, worst case scenario. With me is our health editor, Hugh Pym. Hi, Hugh. So a worst case scenario here. First of all, just lay out some of the numbers and the severity here.
Well, Lewis, the problem is that flu has come early. Normally it starts picking up in December through till a peak in January, and that's what we've seen in bad flu winters in recent years. But it started picking up in October. And what scientists have been trying to work out is this because it's a slightly different strain? That's the conclusion they've come up with. Of course, they have to predict what is the most likely strain earlier in the year when the vaccines are committed. It's spreading more rapidly than usual. So it is still below the peaks that you would normally have in January, but because it's come early, they don't know whether the peak will be bigger than in previous bad winters or will start tailing off sooner. So we've got this figure of more than 2,600 patients with flu in hospital beds in England. That is very high for this time of year, much higher than last year. And they're talking about a worst case scenario in December, basically meaning that if these numbers keep on rising, the NHS, which is always under pressure at this time of year, will come under sometimes intolerable pressure because of flu. But the perspective is we're not near the peaks that have been seen before. It's just it's happening earlier and there's a lot more uncertainty.
And on top of this, potentially a strike by some doctors. What's the latest on that?
Well, it's planned for England next week, starting on Wednesday the 17th for 5 days. And already up until now, NHS bosses have been saying it's a really bad time of year for this sort of thing to happen, particularly with flu cases rising. It's going to cause real problems. I mean, emergency care will be covered by senior doctors, by consultants, and the public are being told that if they're ill and they have a problem, they need to be in A&E, that will be there for them. It's planned care, which is postponed, which is a problem for those patients. But Wes Streeting, the Health Secretary covering England, came up with a new offer to the Doctors' Union, the BMA, last night. Now, there's no more money on the table, but he's addressing an issue which has affected some newly qualified doctors, that there aren't enough training places to continue their career progression into specialist areas. So he's doubled the number of training places. He said there'll be emergency legislation to prioritise UK trained medics. But the British Medical Association will consider all this, do a survey over the weekend, and then tell us on Monday whether that strike will go ahead or not.
OK, Hugh, thank you very much for that. And Hugh will be contributing to our live page because many, I'm sure, watching will have questions about, well, the flu cases, of course, this worst case scenarios we've been hearing, but also in mind for tips, knowing the difference between flu, a cold, COVID, things you can do yourself, all on BBC News website and on the BBC News app. And as I mentioned, Hugh will be contributing to that later.